Let's see the second case from Testis. Okay, this is the testicular tissue of. It's a large tissue. It's not a small biopsy, and it could be orchidectomy or something like that. It must be a very severe disease, or is a serious kind of disease. Could be. So, what do you think? So, first, what are we dealing with the anatomic structure? I don't see much anatomic distinction. Whether this is testis, whether this is epidermis, I'm not very sure about it. And we don't see any tunica layer. Maybe tunica layer is also infiltrated by something. And in very low power view, we are seeing some kind of pale and bluish areas. I'm thinking about seminoma. I'm not sure. I can be wrong in higher power view, as usual. So we need to keep up a little bit. Okay, what do you think? At this magnification, we are seeing some tropiculae of pale areas here and there, between which very pink fibrovascular subtae are identified, and here some bluish areas noted. So I think we are dealing with some kind of seminoma-like tissues, seminoma-like tumor. At least I think we are dealing with tumor. And the tumor is infiltrating these tunica albuginea if present. If present, I'm not sure whether the albuginea is present in the section or not, but I don't see any tunica albuginea. This could be um, not included in the section. Usually, is included in a section of this kind of large tumor. Um, so I think the tumor infiltrates the tunica layer, the tunica albuginea, vaginalis also. Here in this area, I think this is the hilus or reti of testis. I think it was previously could be reti. We have seen some large blood vessels of arteries and vein. Also, this area is also infiltrated by the same tumor. So it is the tumor is a little bit aggressive tumor. Um, the stage could be T2 or something like that, not T1. Here we can see a little bit of tunica layer. Maybe I don't know. I don't know. I'm not sure. Okay, let's go closer and find the cellular detail to find out what the tumor looks like. It's blurry, a little bit blurry yet. Hmm. This area is a little bit more clear than other areas. Let's wait a little while, and let's discuss about what we are seeing here. Is we must wait a little time for the to become more clear photos. But I think we can appreciate that this is fibrous cells are infiltrated by lymphocytes, and these tumor cells are basically clear cells. Let me do something. this. Okay, better. Okay, better and better. Ah, thank God. Thank God. All right. Yeah, some kind of necrosis and apoptotic bodies and also noted. So this could be tumor necrosis. Here is what I said about the fibrous vascular septa. This is vascular. This is blood vessels. This is fibrous septa. They're infiltrated by small lymphocytes. These are small lymphocytes. Sometimes there can be plasma cells and also histiocytes can be seen. So individual tumor cells are this component. We are seeing clear cytoplasm with distinct cell membrane. This is round nuclei. The nuclei resemble one another. They are really monotonous nuclei. In the highest power view, you're seeing some kind of prominent nucleoli, maybe single nucleoli within the center of the nuclei. So this is the answer. So the nuclei they have boundaries. The nuclei have boundaries. They don't overlap. They don't overlap, and the cytoplasmic boundary is also prominent. Here, yeah, better view. Cytoplasmic boundaries is also prominent. It looks like the fences or border, very thick eosinophilic cytoplasmic borders. The nuclei variably bearing prominent nuclei and to inconspicuous ones. They don't overlap much. They have spaces between 1 to 2 nuclei between nuclei. There are spaces between nuclei. That is the distinguishing characteristics between embryonic carcinoma. What I'm talking about is the seminoma, the characteristic of seminoma. They may have this kind of clear cytoplasm, or sometimes they may have cytoplasm which is eosinophilic. But the distinguishing feature is the nuclei are not very overlapping. They respect each other's boundary. And prominent nuclei can be seen. And in the fibrous septa, there are some lymphocytes, which are reactive lymphocytes. Here, reactive lymphocytes. You can see these reactive lymphocytes here and there. So let's enjoy a little bit more. Clear cytoplasm, brown nuclei. If we know the diagnosis, we also need to calculate the staging, at least the disease staging of the tumor, and we better need to understand how to stage a testicular tumor. What I know is if the tumor invade epididymis or the tunica epigenia, the stage goes up, and also if the tumor invades the base of the base of the spermatic cord, the grade goes up again, and something like that. And if the tumor has a lymphovascular invasion, the stage goes up. So we need to find out these kind of things, whether the tumor invades tunica. So as I said before, I'm not very sure, but I think I suspect that the tumor invades at least tunica, and I'm also suspecting invading or on the in the epididymis, and we need to correlate with the growth findings. So I will write the diagnosis as seminoma. So let's see the diagnosis whether we are correct or not. Yes, yes, the diagnosis is correct. It is seminoma. Okay.